All right, for this injury, we're going to immobilize an ankle injury with a splint. So I'm going to show you two different splints that we can use. We have a Pro Splint and then a simple blanket. So when we're doing all of our skills, make sure that you have the appropriate BSI on. Once we have taken our BSI and we approach the scene, we're going to have our partner take manual stabilization of the injured leg. Right. As we come up, we're going to assess CMS. Now to assess CMS on the extremity, we're going to go ahead and check for a pulse. And so we can check in that posterior tibialis. We identify a pulse. We're going to have our patient wiggle their toes. And we're going to see if they have sensation, if they can feel the toe that we're grabbing.
Yes, I can.
All right, so now for an ankle injury, the first way that we'll show is with the blanket. And so on the ambulance, you should have a bath blanket or a patient blanket. A pillow can also be used for this. What I've done is taken the blanket and just folded it up to form a roll. All right, so when I'm getting ready, I'm going to go ahead and take two cravats. These cravats I'm going to stick underneath or slide underneath the leg. Now, without moving this patient, we should be able to, if we can try to slide it under. Because we're talking an ankle injury, we may want to slide them down. We also have a gap underneath the knee that we can go ahead and slide the cravats. And now it's just a matter of kind of seesawing them into place. Okay, so once my cravats are laid out, I can take my blanket and we're going to wrap underneath the foot. And now my partner is going to grab onto the edges of the blanket and maintain stabilization with the blankets. So now I can take my ties. And then once we have that stabilized, we can go ahead and check for CMS. Once again, we can check a pulse. If we need to, we can check the dorsalis pedis pulse on the top of the foot, have them wiggle their toes, and we're going to check sensation on the toe to make sure that they can still feel. So this is the first option. Now I'm going to take this off and show you the other way as part of this video. So if we're not going to use the blanket, we do also have a Pro Splint option. And so we would have our BSI, we're going to have our partner hold manual stabilization, we're going to check for CMS, wiggle the toes. You feel that? So on the ambulance we have different size Pro Splints. Now this one's a full leg one. They also do make some smaller ones to go ahead and immobilize that ankle. And so we could use the large one. Otherwise, we can use the smaller one for the ankle. Now, whenever I use a Pro Splint, I like to add padding into it, and so I'll just use a trauma bandage or trauma dressing. And lay it on the inside of that Pro Splint. It just adds a little bit of padding to the blue foam. All right, so once we're ready to place this on, we've checked our CMS, we're going to have our partner basically while supporting the leg, and in this case they're going to support the bottom of the foot here because it's an ankle, and they're going to lift ever so slightly, and we're going to slide our splint. And we're going to go ahead and place that patient's leg back down, and then our partner can retake stabilization on the splint. So now we're going to start strapping our Velcro. And on all of these leg ones, you'll see two straps on the bottom that basically keep this part at that 90. So we want to make sure that we're going the full distance and removing that and then securing it so that that foot is sitting at roughly a 90-degree angle, which would be its position of function. We throw our last strap on. I'm going to reassess for CMS, have them wiggle their toes, and check for sensation. And so those are the two options for splinting an ankle. We have a blanket and a Pro Splint.